So today I'm going to be talking about the rotator cuff, where the rotator cuff muscles are, which ones are they, and where you would typically have pain patterns if you have some kind of injury to the rotator cuff itself. So the rotator cuff are four muscles. There's the supraspinatus, the infraspinatus, teres minor, and subscapularis. And together they work to keep this humeral head, which is the head of the ball and socket joint of the shoulder, into the glenoid fossa, which is the socket part of the ball and socket joint of the shoulder itself. So the supraspinatus are all on the back. The supraspinatus is going to be the muscle right here above the spine of the scapula. It's going to fit right into that little groove, that little pocket right there, right above the spine of the scapula on the scapula itself. The infraspinatus is going to be right below it on the scapula again. It can be very tender when you touch it. It's commonly tender. And it's going to be on the lower part of the scapula or the shoulder blade. And then off to the side, about midway off the outside border of the scapular shoulder blade, is your teres minor. And then on the inside part of that shoulder blade, that scapula, on the inside of it is your subscapularis. They're all going to kind of snake around and attach on to this arm bone here. Now, you would commonly have pain from the rotator cuff. A lot of times it's going to be kind of to the outside of the shoulder here, because commonly it's the supraspinatus that is torn the most. However, you can have pain a little bit towards the back, because you can have problems with the posterior rotator cuff, which is considered teres minor, and infraspinatus. So you can have pain here. It's more common right here, and it can also be common in the anterior or front side of the shoulder, and a common referral pain pattern for the rotator cuff is down the bicep. And again, just because you have this pain doesn't mean you have a rotator cuff tear. Tendinitis or inflammation of that tendon or those tendons of the rotator cuff is much more common than an actual tear.